Namaste. This is Dr. Vaishali Ashok Bhide, MD Homeopathy. Today we are talking about cons or callosity. In simple terms, a con or callosity is nothing but thickening of the area of the skin. Now, whenever it is a small point of thickening, which may be rounded or oval in shape, most commonly we call it a con. However, when it is a patch which has become thickened, we would call it a callosity. To understand a con, we do not require any medical science. It is simple mechanics with which we can understand why a con develops. Whenever certain area of the body is subjected to friction or to pressure or to tension, the skin feels uneasy or the body feels uneasy. Therefore, more and more tissue is deposited and the area becomes thickened because of this friction. And this is how a con or a callosity is formed. So what exactly happens is, the commonest example is ill-fitting shoes. So when you have ill-fitting shoes, there is certain area where beneath the foot or on your soles, the body feels maximum pressure. Usually it is at the base of the great toe or the last toe or the sides or in between the fingers where the friction occurs. And this is the spot where more and more thickened tissue is deposited, and that is where the con develops. So the commonest reason for the development of cons is ill-fitting shoes or hard shoes, which means hard and inflexible soles. Then mechanical work, if a person is handling heavy objects or doing constant mechanical work, in that case there is a constant friction between the object and the skin, like a carpenter or electrician. In such cases, it is the hands which can develop cons. People who are obese, in them also cons usually develop at a larger scale because there is more pressure on their feet. People who sweat more also tend to have more friction and uneasiness, causing the formation of cons or callosities. It is more commonly seen in diabetics. So what is the treatment of cons? The only symptom for which patients complain of con is that there is a severe pain, especially when they are walking. And this is the reason why they are seeking the treatment. So as we have understood that con to start with is a very mechanical factor or a mechanical reason. So to remove that reason is the most important thing in the treatment, because if we would keep the same reason and treat, then one con would be replaced by the other. This is what usually happens in patients who will use con caps, who use ointments but not change their footwear. So when patients approach me first, I see to it that we remove the mechanical cause which is caused the starting of the con, and with that homeopathic treatment or homeopathic medicine is prescribed. To select the medicine, we take a long case to understand how the disease has progressed. Here, as homeopaths, we face the problem of plenty because we have too many medicines for con. So we take a detailed case to come down to a close set of medicines and then further differentiate with the modalities. For example, when is the pain more? Is it pain more in the morning, afternoon, evening or night? Which moment causes maximum pain and what gives relief? In this way, we are able to give relief from pain to the patient, and slowly the con also responds. The thickened area starts becoming less thickened and then it comes back to the normal skin. That is how a con is treated. As I mentioned earlier, it is most important to remove the mechanical cause which is causing friction. Without that, we cannot complete the cure. So initially, if there is a small con, it is just a beginning. I first ask them to only change their footwear and not give any medicines. However, if it persists or if they have had this problem for years together or months together, then I start with the treatment, because then the skin is already thickened, and then we couple with the lifestyle management. I am currently practicing in Dadar West, Shivaji Park area at Sapra's Polyclinic, Malik Building, DV Deshpande Mark, Shivaji Park, road number 4, from 10 in the morning to 7 in the evening on weekdays. You can also follow me on Instagram and Facebook. As you all know, I had published my first book on homeopathic medicine titled Unlocking the Bogus Synoptic Key Part 1. I am delighted to announce that I will be soon publishing my second part of the book titled Unlocking the Bogus Synoptic Key Part 2. Thank you. Stay healthy, stay blessed.